I propose to take questions 4 to 12 together. Cabinet Committee E last met on the 11th of April 2018. The next meeting of the Cabinet Committee has not yet been scheduled. In addition to meetings of the full Cabinet and of Cabinet Committees, I meet with Ministers on an individual basis regularly to focus on particular issues. In this regard, I meet regularly with Minister Harris to discuss issues related to our health service, including last week. Support for Cabinet Committee E is provided by the Social Policy and Public Service Reform Division of my department. The Minister for Health has primary responsibility for the preparation of documents relating to health policy. The Government is committed to enhancing the quality of the health system. 2018 has seen the highest ever level of health funding in the history of our country, and the Government has also allocated significant capital funding of almost €11 billion for health over the past 10 years. That's double what was provided for the previous 10. This is investment, of course, in new buildings, equipment and ICT. However, in order to ensure meaningful and sustained improvements in the health service, we also need to deliver a major programme of reform. Important milestones have been reached in recent months. The Minister for Health launched the Sláinte Care implementation strategy in August. This provides the framework within which a new system-wide reform programme can be advanced. The new programme office has been established and is now led by Laura McGahey, and a Sláinte Care Advisory Council has been established, which will be chaired by Dr Tom Keane, who led the reform of our cancer services in Ireland some years ago. The new structures will support and drive the implementation of the reform programme. Work is also underway to establish a new HSE board to strengthen the management, governance and accountability of the executive. Kieran Devan has been recently nominated as chairperson designate of the HSE. He is Chief Executive of the British Council and was a Chief Executive of the UK health charity Macmillan Cancer Support, and is also a former member of the board of NHS England.
Now, there are so many questions grouped here, but I think we have to insist that we stick to the time allocated. Our first contributor, Deputy Mayor Lou McDonald, please.
Agus Gambuicus leis an Taoiseach asachta chuid freagra. Taoiseach, you recently visited the site of former mother and baby home in Tuam, where hundreds of babies are buried. As you know, Taoiseach, the survivors of the home and the families of those who resided or died there have expressed disappointment that you didn't meet with them during your visit. I wrote to you in August asking that you meet with Catherine Corliss and the Tuam baby home survivors, and I would ask that of you again. We owe a lot to Catherine for her research, which uncovered the deaths of 796 children at the home. And had you met with Catherine and the survivors, and indeed when you meet with them, you'll hear firsthand of their particular healthcare needs. One child every fortnight died when the home was in operation. Many of those who survived a regime of malnutrition and neglect, where measles, tuberculosis and pneumonia were rife, now suffer very significant ill health. And yet the government has yet to provide a scheme specific to their needs. 3 years have passed since the Commission of Investigation into Mother and Baby Homes was established, and its timeline for reporting has been extended to February 2019. And we know from the industrial homes and the Magdalen laundry scandals that the state moves at a glacial pace in providing redress and access to supports and services when finally accepting wrongdoing. Survivors of the home need access to health services today, Taoiseach. Many of them are elderly, very many of them are really very unwell, and I want to ask that the state have healthcare provision in place for these survivors, and I would ask that you act on that with all due haste.
Thank you. Taoiseach, has the Health Committee met to discuss the health budget? There are constant leaks to the newspapers that the likely level of deficit in the health service is to run anywhere from 800 million to 1 billion this year. I just don't know how a functioning health minister can actually be in charge of a department where that level of overspend and lack of control and lack of involvement in the management of the department is such a regular feature of this particular department that Fine Gael have run now for over 7 years. And you know, it means that the situation, for example, of children with scoliosis is always going to be out of reach of being addressed. When I was Taoiseach, I secured extra funding, which you used to build the additional facilities. And yet I read harrowing accounts every week from families, particularly with children with special needs, who also are affected by scoliosis. And the numbers are growing and getting further away from their surgery. How can you countenance a minister in your cabinet entirely unable to even influence the level of the budget? And how can you talk about sláinte care really happening if there is no concept of what a proper budget for the department is? It is a total failure and shambles by your government.
I suppose, first off, the last meeting of the Health or the Cabinet Subcommittee is almost 5 months, and you had a launch of the Sláinte Care report, or the Sláinte Care, the implementation body, in August. In quite news months. Was that the reason for it? But I think we really have to look at a number of issues, and I raised it twice since we came back in relation to the order of business. The home care packages, the home help system, which is providing an excellent service the length and the breadth of the country. But the frustration that is there with particularly families who are trying to get care for their elderly people, and to bring those elderly people back into the communities, back into have a quality of life in their own communities. And I believe personally that the home care packages, or the home health teams that are out there that are providing such a service, are saving the state millions. If you look at it in relation to the Fair Deal scheme, or the nursing home subvention, what you want to call it, but they are saving millions. And the Minister did make the point in relation, or the Minister's responsibility said in relation to it, that there wasn't staff available. That's not my information. That's not my information. People that are working on the home help teams around the country, their hours are being cut, and that there's new contracts being issued into, there's negotiations between the HSE in terms of their pay and conditions, and it isn't that there aren't people available to take them up. Also, in relation to the waiting for services, particularly young kids who are waiting for diagnostics and indeed for interventions, the crisis is, there's a huge crisis out there on it.
Taoiseach, I've raised this issue numerous times in the 2.5 years I've been elected here, but I understand over the summer the Minister for Health brought a memorandum to the Cabinet in relation to the medical cannabis access programme, and over the summer the Department of Health issued guidelines about the access programme. Some are kind of quite flawed in my eyes, but so forth. And this has been going on for a very, very lengthy period. And Taoiseach, today there's a man called Kenny Tynan, and Kenny is from Roscommon, a Farda 4. And how ludicrous the situation has become. Kenny was granted a licence 1 month ago from the Department of Health, signed by the Minister, and today he was sent an email by the Medicines Management Programme to say that they would not reimburse the licence. So the licence system is literally unworkable. People are getting licences while they can't afford it. On average, it costs tens of thousands to engage, to go off to Holland 4 times a year and get the medication. So the system is completely flawed. Even in Britain at the moment, the Tory government have changed their policy, very, very restrictive, but people are at least gaining access to medical cannabis. It saves them going to the black market or going abroad. So the situation is unworkable, Taoiseach. I think you have to show leadership. This has been going on for years now, and there has to be some sort of clarity either on the licence system, the medical cannabis access programme, or the legislation I put forward.
Yeah, Taoiseach, I want to raise the issue of Sophia Daly, a case you, I think, are familiar with, who's 12 years old, has cerebral palsy, arthrogryposis and scoliosis, and was diagnosed with scoliosis in 2013, was put on an urgent waiting list in April 2017 for surgery, and in August, 17 months later, was taken off that list and now is not on any list, even though The Minister claims there's only 20 people waiting longer than the 4 months, which he said was the longest anybody would be waiting. Sophia, I talked to her father today, is in increasing pain. The screws in her back and hip are loosening. She may have to be taken into emergency surgery because her condition is deteriorating. Her internal organs have been affected. Her curvature is significantly increased. This is completely unacceptable, Minister. And Aaron, her father, said he has asked on several occasions to meet the Minister. Minister Harris is refusing to meet Aaron. He asked me to ask you, what are you doing about the backlog? Apart from, it would appear, manipulating the figures as to the extent of that backlog. What is being done with the treatment abroad scheme to clear that backlog so people like Sophia can get the surgery they so urgently need?
Question, which is a single question, to a response on this, because otherwise the Taoiseach will only have 2 minutes to respond to quite a lot of questions. Are we agreed? Taoiseach, we have 5 minutes then.
Thanks very much. On the first question first, I made a private visit to Tuam on my way home from a conference in Galway. It was just an opportunity for me to pay my respects to the children who were buried there and to see the site for myself, and it wasn't quite what I expected. I expected to see the grounds of an old abandoned institution. It's not that at all. It's a very small site, almost within a housing estate beside a large playground. I only had about 30 minutes, so I would have liked, obviously, to have been able to meet with Catherine Corliss, with representatives of Fibres, with the residents around there who've their own concerns, and the local authority. But in the period I had, which was about 30 minutes, 40 minutes, it wouldn't have been possible to do that or to do any of them justice. So it was a case of either postponing my visit for a later point in a few months' time, or taking the opportunity to stop by and pay my respects and see the place for myself, which I did. I have replied to Catherine Corliss, and Catherine, I'll certainly meet her with Catherine's opponent, because Catherine obviously is the person who is dealing with the decision for the government and understands it in a depth that I don't. And I'll be with her in due course when we're ready to make a decision on the next steps. In terms of the Health Cabinet Subcommittee, the Cabinet Subcommittee hasn't met to discuss the HSE budget overrun, but it has been discussed at full Cabinet, and as deputies will know from my previous replies to questions on this, I tend to discuss more things at the full Cabinet than would have been done in the past. In the past, I think bodies such as the EMC or smaller groups were used to discuss important issues, and I've decided to do it differently and to include the entire Cabinet more and be more collective in decision making rather than using bodies such as the MC, which I think excluded ministers from decision making in the past, and I'm glad to have made some changes in that regard. It has obviously as well, of course, been discussed with Minister Donoghue and also the Minister for Health. We're trying to get an accurate fix on the likely overrun. We often talk in healthcare about how money should follow the patient and money should get to the patient. We're not actually in a very good position to follow the money at all in the health service due to very outdated financial systems. So we're trying to calculate at the moment what the likely overrun is going to be for this year. But as things stand, health spending, notwithstanding the fact that health has a huge allocation, €16 billion, the biggest ever in the history of the state, health spending is running 9% ahead of what it was last year. So that overrun could be quite substantial in the region of the figures that people have seen in the newspapers, and that does certainly limit our room for manoeuvre when it comes to the budget in 2 weeks' time, because so much of that overrun will have to be accommodated in the base for next year as well. A lot of it is happening, though, for good reasons. Recruitment is happening at pace. There are 1,000 more nurses working in our public health system than we had this time last year. There have been pay increases across the board for healthcare staff, 115,000 of them. Our Children's Hospital is flying up. The Urgent Care Centre in Blanchardstown is almost roof on at this stage. We've extended things like GP care to carers, because they need to be cared for too, free GP care to carers. And also we're seeing a substantial reduction now in the number of people waiting for operations and waiting for procedures in our hospitals, whether it's hips, eyes, knees, cataracts, angiograms, skin lesions being removed. There are 10,000 fewer people waiting for an operation or procedure now than we had a year ago. And the average person is waiting less than 6 months now for an operation or a procedure. We want to get that down to 3 months over the period ahead. In terms of medical cannabis, as I understand it, it's required that you have a prescription from a consultant, and also that you have a licence from the Minister for Health. And obviously that's an unusual situation and not one that is desirable or workable. I can guarantee the House that the Minister for Health, while he has signed all or perhaps all bar one of the requests for a licence, doesn't want to be in the situation where he's doing that. It's not really the role of a politician to be signing licences for individuals to have their medicines, and that's why he's developing the Cannabis Access Programme to do it better. I do understand that they are running into real difficulties with sourcing, and if this is a medicine, it needs to be treated like a medicine, and you need to make sure that it is at pharmaceutical grade and medicine grade, and they are running into difficulties in sourcing it. In terms of Deputy Boyd Barrett's question, I'm not in a position in the House to talk about individual cases or individual patients. I don't have access to patients' files or patients' records. No politician does or should. And obviously there are issues of confidentiality and privacy involved in any individual case. What I can say more generally is that patients can be moved to what's called a suspended list. So a patient who may be on a waiting list for surgery for any number of reasons may become unfit for surgery for a period of time, and they're put on the suspended waiting list, but can then be put back on the waiting list or the active waiting list when they're when they're fit for surgery again. But as I say, I don't have any information or the full information on an individual case, so it would be wrong for me to comment on an individual case. What I am told, though, is that the scoliosis figures for the end of January show that there are 188 patients, of which 109 are spinal fusion patients on the list for spinal surgery. Of the 90 who are actively waiting, 14 are to come in. That means they have a date for their surgery. 40 are suspended, and 44 are on the planned procedure list. So there's an indicative date for their procedure. The Minister for Health has prioritised the development of sustainable scoliosis, and an additional 9 million has been provided to the HSE this year, specifically to develop paediatric orthopaedic services, including further increasing access to those services.
Question 13.